Greetings and welcome. It is 2:02. We will be starting our event today. Thanks to everybody in the Grand Junction, Greeley area for joining us. We're thrilled to have you. And Mary, our chair of our advocacy committee, if you would not mind, kick us off.
I will, and it's not Grand Junction today, but Fort Collins.
Oh, sorry. Northern Colorado.
Yes.
Northern Colorado, sorry. Gosh darn it. It's our last one, forgive me.
No worries. Good afternoon to all of you in Larimer and Weld counties. I am AARP Legislative Advocacy Chair Mary Fries, and I want to welcome you to this presentation and discussion about AARP Colorado's legislative activities. Before we get started, we have a few housekeeping matters. Please mute your line because we get echoing if people have their lines open. If you would like to ask a question, please type it in the chat box. At the end of the presentation, there will be about half an hour to address questions. You may have to move your cursor or your mouse for the mute and chat buttons to become visible on your screen. And this presentation is being recorded and will be made available later. Today's agenda items include introductions, AARP advocacy meetings and process, AARP at the federal level, Colorado state issues, the budget, utilities, Colorado Secure Savings, healthcare and pharmaceutical bills, and then questions and answers. We'll start with introductions. Today's panel includes both AARP staff and AARP volunteer advocates. Bob Murphy has extensive private and public sector background, including 22 years serving the residents of Lakewood, Colorado as planning commissioner, city councilor, and mayor. Bob joined AARP as Colorado's state director in 2016. Kelly Fritz is an associate director with AARP Colorado and is the legislative advocacy representative. She works with the advocacy volunteers to promote AARP goals at the state level. Kelly joined AARP in 2001. Leslie Kalishman is vice chair of the legislative advocacy team and spent 37 years as a licensed clinical social worker, both in medical and behavioral health settings. She currently is a member of the Palliative Care Conference Steering Committee for Metro State University in Denver. Bill Levis is the lead volunteer utilities advocate for AARP Colorado and had been consumer counsel representing residential customers before the State Public Utilities Commission. A.W. Schnellbacher is an AARP Colorado volunteer advocate and was a member of the AARP State Executive Council. He retired after 30 years with the U.S. government, 27 years spent with the federal Medicare and Medicaid programs. And I am Mary Fries. I'm a retired physical therapist, clinician, and administrator with practice areas that focus mainly on neurological conditions and with frail older adults. So that wraps up the introductions. Next on the agenda, how's it going with the slides?
We're doing okay there.
Okay.
Can you see them?
I can't see them.
You can't see them?
Nope.
Oh, they kicked, okay, never mind. My content got kicked off again. I was watching them. I thought you were too.
No worries. Thanks for everybody for your flexibility. Yeah, this virtual communications, we're still getting used to it. Next up is AARP in Colorado, volunteer meetings and process. The AARP Colorado Legislative Advocates are volunteer lobbyists registered with the state of Colorado who work on behalf of those aged 50 plus. Most advocates are retired and many professions are represented. We serve as nonpartisan advocates in areas of healthcare, utility infrastructure, housing, retirement benefits, transportation, consumer protections, and many issues that don't have a defined category. Always important are the issues of strengthening Social Security and other retirement savings efforts, promoting adequate and affordable healthcare, and fostering livable communities. During the legislative session, January through early May, advocates meet weekly as a group to to review legislative bills, discuss emerging issues, and plan lobbying actions. When a bill is introduced to the group, individual advocates sign up to be on the small team that will work on that specific bill. Between meetings, team members research aspects of each bill, track the bill through the legislative process, and report back at weekly meetings to provide updates, foster group discussion, and facilitate the position that AARP will take on the bill. Positions include strongly support, monitor, which means we're keeping an eye on it, oppose, and strongly oppose. Occasionally, we'll take an amend position when we are lobbying for specific changes to a bill. For bills where we take a strong position, strongly support, strongly oppose, or amend positions, team members on that bill will testify at House and Senate hearings, usually accompanied by a gaggle of advocates in the gallery dressed in white AARP shirts to show support for AARP testimony. Additionally, advocates are in contact with legislators, are outside House and Senate chambers lobbying on specific bills, and work to educate the community via various media outlets. We celebrate all holidays, and there'll be a photo coming up that was taken in a weekly meeting during Mardi Gras. Personally, it feels great to work for the benefit of others in the state, and the best thing is working with the people on the team. They're dedicated, fun, and serious about the work, and there's a great team feeling. So if you're interested in joining the advocacy team, please contact Kelly Fritz at kfritz@aarp.org. Next up, Bob Murphy is going to talk about AARP at the national level.
Hi, everyone, and welcome to our friends and members from Northern Colorado. Really glad you could join us today. I'm going to spend just 3 minutes talking about 4 federal issues that we've been working on for the last several months. Number 1 is Social Security. Number 2 is response to the coronavirus pandemic. Number 3 is our voter engagement campaign. And number 4 is our response to concerns about the U.S. Postal Service. So first, Social Security. It's always been, protecting and enhancing Social Security has always been a pillar of AARP advocacy. And particularly since the president's early August memos suggesting a potential payroll tax cut that could impact the Social Security Trust Fund, we've been hammering home our message. Social Security is an earned benefit. It's not an entitlement. It's a program that workers have paid into their whole lives. We'll never stop fighting for this promise that must be kept, and any effort that puts it in jeopardy will be met with fierce opposition from AARP and from our 38 million members. Our CEO, Joanne Jenkins, wrote a letter to the president on August 13th, asking him both to explain himself on the payroll tax issue and explain how he would protect and enhance Social Security. Haven't received a response yet, but we certainly got our message across. We're also working with the Treasury Department and Congress, and I think as of right now, the concern has waned a little bit. We don't think this effort has really got much in the way of legs. Next, our coronavirus response. The first thing we did, and this is way back in March, was also related to Social Security. In a matter of just a day or so, we quickly got the original CARES Act amendment amended so that Social Security recipients would also be able to receive that $1,200 stimulus check that was not part of the initial legislation. And since then, our focus has been on the tragic situation in our nursing homes around the country, where over 76,000 residents and staff members have passed away from COVID. Our lobbying at the federal and state levels has focused on transparency of reporting of cases and deaths, and certainly on supplying adequate PPE, adequate paid staffing, adequate testing, and very importantly, the capability for visitation by loved ones. And I always stop here and give kudos to Governor Polis and the Colorado Department of Public Health and Environment. They've been very active on this issue. They formed a residential care facility strike force response team. They met daily for 3 months, April through July, and continue to meet. And I'm happy to say that visitation has progressed from none to virtual to outdoor visitation, and now to indoor visitation is allowed with certain criteria. Next, our voter engagement campaign. It's in high gear right now. We have multiple goals. Number one, remind all of us as 50 plus to cast our votes and to do so early. Number two, let the candidates know the importance of the 50 plus vote. More than half of the votes cast in this country will be from the 50 plus. And let them know that our issues are important to who we choose to vote for. And those issues are Social Security, Medicare, reduction in prescription drug prices, and of course, healthcare, and the coronavirus situation, which a lot of our members and a lot of Coloradans are very concerned about. And finally, the U.S. Postal Service. We're as concerned as many Americans about the capability for the post office to ensure timely delivery of ballots, particularly here in Colorado as a mail-in state. So our Executive Vice President, Nancy Lamond, wrote an August letter to the Postmaster General. I've been in direct contact with our Secretary of State, Jenna Griswold, and we've been working very hard to let our members know that their ballots will be dropped October 9th, should arrive by the 12th or 13th, and to vote early. Get the blue book, make your decisions on the ballot issues, but then drop them in the mail or take advantage of those many drop-off boxes that are located throughout your counties and get that vote in early. So thanks, and I'll be back at 2:30 to answer questions and talk about state ballot issues. Thank you.
Thanks, Bob. Have a good meeting.
Thanks.
Next on the agenda are Colorado state issues. I'm going to start with an overview of the Colorado budget in the year of COVID-19. The 2020 legislative session started January 7th and was rolling along. The Joint Budget Committee, JBC, had already prepared its 2020 through 21 fiscal year budget recommendations for the General Assembly to consider. Then the legislative session was suspended on March 14th due to COVID-19. Soon, the economic impacts of COVID-19 became clear, with projected general fund revenues decreased by an estimated $4.3 billion, or about 16%, for fiscal years 2019 through 20 and 2020 through 21. With an estimated $3.3 billion shortfall, the budget needed to be reworked. During the adjournment, JBC members identified and considered many budget balancing options, cutting tax loopholes, transferring reserves, applying federal COVID-19 money where permitted, but mostly having to make cuts. After a 10-week hiatus, the legislative session resumed May 26th with a short 3-week session focusing on high priority legislation. Many bills were taken off the table due to fiscal impacts and time constraints by the shortened session, but finalizing Colorado's 2020 through 21 budget was a priority, with the fiscal year just a month away, beginning on July 1st. The 2020 through 21 state budget is $30.3 billion and reflects cuts of $3.3 billion due to revenue shortfalls secondary to COVID-19. Some of these cuts include K through 12 education, $621.5 million cut, higher education, $598 million cut, Department of Transportation, $50 million cut, state agency personnel services were cut by 5%, and that's salary, health, dental, et cetera, to state employees. PARA, the Public Employees Retirement Association. In 2019, a law was passed to shore up PARA, with the state providing annual payments into the program. The 2020 through 21 unfunded liability payment of $225 million from the state has been deferred for this year. Not cut was the Senior Disabled Veterans Homestead Exemption, and this was accomplished by a lowering of the general fund reserve. So $162 million was not cut from the homestead exemption. The legislative session ended on June 15th with JBC warnings that budgeting for the 2021 through 22 fiscal year may be a harder process due to further economic consequences of COVID-19. There's also a ballot measure, Proposition 116, that if passed would also decrease income to the state. The JBC is scheduled to meet on September 18th. That's tomorrow, to start its budget work again. Next on the agenda is update on utilities, and for that we go to Bill Levis.
Thank you, Mary, and hello, everybody. This last legislative session, AARP actively supported passage of Senate Bill 130, which requires increased disconnect protection through the State Public Utilities Commission for residential utility customers. This is especially critical during the pandemic, and the PUC will be adopting rules on disconnection later this fall. AARP helped defeat several bills that would have increased utility company profits in an era of declining costs and would have raised residential utility rates. And it would be helpful if you would mute your lines, please, because I'm getting some feedback. AARP was an active party in Excel's electric and gas rate cases, resulting in a 75% reduction in the electric case and a 40% reduction in the gas case based on what the company had requested. There also were substantial reductions in what Excel could earn in both cases. In the electric case, the reduction was over 10%, and it was 7.5% in the gas case, which did include Fort Collins. Also, AARP was instrumental in keeping fixed monthly charges in the gas case, including, as I said, in Fort Collins, at $12, after Excel had advocated increasing it by 25% to $15. We also worked directly with Excel and the PUC staff in making notice of any rate case going forward more understandable to customers and giving consumers more information about how they could protest proposed increases to the PUC. AARP was also instrumental in getting customers time to analyze their electric usage, and as a result, giving them choice whether they wanted a flat or time of use rates as Excel converts to smart meters. And we do know the smart meters are available in Fort Collins, so it's probably important that all of you figure out whether smart meters can benefit you and when you should be using your electricity. AARP also continues to work against Colorado joining a regional transmission organization that would increase rates and moves oversight from the state PUC and municipalities such as Fort Collins to the Federal Energy Regulatory Commission, where rates would be higher. Finally, AARP supported passage of House Bill 1293, which transitioned the 911 emergency service system from an analog to an internet-based one, providing texting and video calling throughout the state. Presently, texting is not available in Pueblo and in certain communities on the Front Range and along the mountain corridor. To facilitate the service, to promote safety, and decrease outages, AARP also supported a statewide charge. Thanks a lot. I'll send it back to Mary.
Great, thanks, Bill. And just letting everybody know, Bill has been working triple time this year, representing and protecting customers or consumers on utilities issues. Thanks, Bill. Next on the agenda is the Colorado Secure Savings Program. The creation of the Colorado Secure Savings Program has been a high priority, with AARP Colorado strongly supporting this legislation over many years to promote a better quality of life for retirees. In January 2020, AARP advocates met up with Treasurer Dave Young. Treasurer Young has been a key promoter of Colorado Secure Savings legislation. In 2019, SB 19-173 created the Colorado Secure Savings Plan Board to study approaches on how to increase retirement savings for private sector workers. In February 2020, the Plan Board presented its report, which was the basis for this year's implementation legislation. The report also found that the cost of doing nothing would cost the state $10 billion over 15 years due to retirees having to use safety net services. In 2020, SB 2200 created the implementation of Colorado Secure Savings Program, and some highlights include a Colorado state facilitated program for private sector employees who don't have retirement savings program at their workplace. The program is run by private sector professionals with state oversight via the Secure Savings Board. Employees will automatically be enrolled in the plan with 5% of their earnings deducted from their paycheck and placed into their individual retirement account. Employees can increase or decrease their percent deduction or withdraw from the program altogether. Monies are pooled and accounts are professionally managed with low fees. The account is tied to the employee, so is portable from job to job and can be used when an employee works multiple jobs. It will also provide a strong financial education component. The current status is that this week the governor will appoint the implementation board that will develop the program and execute the implementation. This board will be chaired by State Treasurer Dave Young. The implementation board is a public body that will hold public meetings, receiving comments from the public as the implementation process moves forward. That was a big win for us this year. Next on the agenda is healthcare legislation with Leslie Kalishman.
Well, thank you, Mary, and greetings to our Northern Colorado friends. AARP's first legislative priority for healthcare is the protection and maintenance of Medicare. Colorado has approximately 881,108 Medicare beneficiaries. However, nearly 50% of our Colorado constituency are in the 50 to 65 year age group, and unless they are disabled, do not yet qualify for Medicare. So many of these folks are still working and may not have health insurance coverage through their employment, or may be underinsured with large copays and deductibles, which in essence makes healthcare unaffordable. AARP supports affordable and accessible healthcare. Some highlights of our Colorado health legislation this year. House Bill 20-1236, Healthcare Coverage Easy Enrollment Program. This bill allows Coloradans to request on their state income tax return for the State Health Insurance Exchange to determine whether underinsured household members are eligible for free or subsidized health coverage. This is an opt-in, and those who ask to have their eligibility assessed under this program will receive information about coverage options and assistance with enrollment. We strongly supported this bill, and it was passed and signed by the governor July 6th of this year. Some activities related to COVID-19 health emergency, and this kind of follows what our director Bob had said a little bit earlier, is we just were very, very concerned about hearing about the impacts of the virus in residential care facilities. And so we did outreach to our congressional representatives, urging Congress to support critical needs related to our nursing home residents, their families, and the staff. And these critical needs included transparency of information regarding incidents of the virus in a facility, increased access to PPE and testing for facilities, enhanced virtual visitation for residents and families, and enhanced facility and patient communications regarding any involuntary transfers and discharges. House Bill 20-1425 was the hospital patient visitation rights during COVID-19. The act acknowledges the challenges to our healthcare system caused by the virus. The act encourages hospitals to follow infection prevention protocols and identify ways to improve patient visitation policies. We supported this bill, and it was passed and signed by our governor June 29th of this year. Senate Bill 20-205, sick leave. This was actually a two-part bill. The first part came from the federal emergency funding and legislation, the Emergency Paid Sick Leave Act, which was in the Families First Coronavirus Response Act. All employers in Colorado are required to provide their employees paid sick leave for reasons related to COVID-19 through December 31st, 2020. The federal legislation provides funding for free coronavirus testing and 14 days of paid leave for American workers affected by the pandemic. This covers time spent in quarantine, time waiting for a diagnosis, and time ill. Employers receive refundable tax credits to offset the costs of providing emergency paid sick leave. Part 2 of this act is the Healthy Families and Workplace Act, which starts January 1st, 2021. And this act will require certain employers to provide paid sick leave to employees, accrued at 1 hour of paid sick leave for every 30 hours worked, up to a max of 48 hours per year. AARP supports paid sick leave, and this was passed and signed by our governor July 14th of this year. Senate Bill 2212, reimbursement for telehealth services. This makes more types of care eligible for coverage for telehealth by insurance reimbursement. AARP supported, and this was passed and signed by the governor on July 14th. House Bill 1410. This was COVID-19 related housing assistance. And this concerned assistance for individuals facing a housing related hardship due to the pandemic, and in connection, transferring money received from the federal government from the CARES Act to Colorado's Eviction Legal Defense Fund and Housing Development Grant Fund to provide such assistance. The act provided eviction assistance, rental assistance, residential mortgage assistance, and guidance on other housing assistance to households facing financial hardship due to the pandemic. AARP supported this bill, and it was passed and signed by the governor on June 22nd. Now, we have some additional concerns related to COVID-19 economic impacts on our senior services and programs. The Older Colorados Act, which is Colorado's version of the Older Americans Act, supports state and county level services and programs provided through our 16 area agencies on aging, or what we call the AAAs. The AAAs provide essential information and services to seniors, including our most economically and socially vulnerable. The overall goal is to allow folks to age in place as much as possible. These services include information and referral services, mobility assistance programs, meal services and housing options, case management services to assist seniors and their families in gaining access to services, individual counseling support groups and support for caregivers, respite care, supplemental services such as homemaking, and some personal care, enabling individuals to remain in their homes and communities as long as possible, and some of the senior center gathering places. Now, funding issues for our AAA programs predate COVID. Part of the problem is that there is not a stable source of funding year to year for these programs. And due to the effects of the pandemic on the economy, the state funding projections for 21-22 budget are of great concern, presenting the possibility of cuts in these essential programs and services. And we see these programs and services as being a really important priority in our state.
Thanks, Leslie. Leslie and AW are part of Team Healthcare, the group of advocates that works on healthcare issues. So thank you, Leslie, for the presentation, and to AW Schnellbacher, who will be fielding healthcare questions shortly. Next up is a review of pharmaceutical bills. I'm going to talk about 4 pharmaceutical bills. The first is an implementation update on a law passed in 2019, and the late night photo shows part of that process. SB 19005, Canadian Prescription Drug Importation Program. This act aims to decrease prescription medication costs by importing meds from Canada, working within the parameters set by the federal government. The U.S. Health and Human Services Agency's deadline to complete the drug importation rules has slipped to December 2020, so Colorado's final program request will likely occur in early 2021. Of note, within this program is the possibility of expanding the program to nations beyond Canada, which leads us to the next bill to talk about. SB 2119, Expand Canadian Prescription Drug Import Program. PI stands for Postpone Indefinitely, which means the bill died, and there were a lot of bills that died during this shortened session due to the COVID shortened session. So like the 2019 bill, this bill aims to lower drug prices by allowing the importation of prescription meds from nations beyond Canada. Again, the U.S. Congress must pass legislation authorizing such expansion. HB 201050, Other Outlet Pharmacies Drug Distribution. This act allows registered pharmaceutical outlets to make a casual sale or a loan of prescription medications to another registered outlet when a facility experiences a shortage. This is important so that all these healthcare entities can obtain medications if there is a local site shortage. HB 2012-32, Equity in Access to Clinical Trials and Medicaid. This act authorizes Colorado's Medicaid program to cover routine costs associated with Phase 1 through Phase 4 clinical trials. The Medicaid patient's treating physician determines that the patient has a qualifying disease or condition and that the patient meets the selection criteria for the clinical trial. This bill is particularly important for folks who have exhausted routine treatments for life-threatening illnesses and conditions, allowing them to have access to clinical trials regardless of income status. And now we're going to be taking questions from the chat box. If you'd like to ask a question, please type it in the chat box. You may have to move your cursor or mouse for the chat box link to become visible on your screen. Kelly's going to read the questions, Kelly's going to read the questions aloud and delegate them to the proper responder. We have some questions, and
We already do. We have one from Randy Ross. Randy would like to know. I think this is going to you, AW. WEP and GPO do not significantly help SEC, but do substantially hurt individuals. Is there any interest in the repeal of WEP and GPO?
I'm not sure I can answer that because I'm not sure what all those stand for.
Well, we're talking about the windfall elimination tax,
Yes.
right?
Yes.
So that was, an unintended consequence of the Tax Act of 1986, and that's unfortunate. Affects folks who have worked both in the public sector and private sector, and they get if they have two pensions or two payments coming in, they get money deducted from Social Security. It is really unfortunate. Does that help, AW? I mean, I don't think there's going to be.
And I'm one of those
much progress.
I'm one of those who did get impacted by that legislation since before I went to work for the federal government, I had my 40 quarters in for Social Security. And then I also, and because of that, I got a decrease in the amount of Social Security that I was going to receive.
Yeah.
So it does impact certain people. And the same thing with my wife, who was his pension comes from Para in Colorado. She had her 40 quarters in before we moved to Colorado, and she became a teacher in Colorado. In Colorado, the Para recipients do not pay Social Security. So at the same time, even though she qualified for both Para and Social Security, she got a reduced amount in her Social Security benefits because of that particular provision.
It is something we hear about. I do encourage you to call your member of Congress and our 2 U.S. senators and talk to them about your concerns with that. Right now, I think most of the focus in Social Security, is just protecting it. I think that's where, most of the action is happening in Social Security, but I would never want to discourage anyone from, participating in your government. We have a question from Helene. She does not understand why the U.S., the user of the most drugs worldwide, has to buy drugs from other countries versus negotiating prices nationally. This is one of our very favorite subjects. So I'm thinking, there's several on Team Healthcare who could probably answer it. So who wants that?
I'll go. What most people don't realize, most of the drugs that we do use are manufactured outside of the United States now. It's just that we pay a higher price for them. If we can get those directly from the other countries, then that would lower the price of prescription drugs. The other thing is only the Veterans Administration for the U.S. government is allowed to negotiate drug prices. No, none of the other public insurance programs are allowed to negotiate prices, and that's an act of Congress. So if we were to change that, we need to work with Congress.
There are two bills going through the Congress right now. The first is H.R. 3, the Elijah Cummings Lower Drug Costs Now Act. It establishes fair pricing negotiation program for Medicare and establishes maximum out-of-pocket expenses. It protects against excessive price increases, provides for pricing transparency. This was introduced back over a year, well, about a year ago, September 19th, 2019. It passed the House December 12th, went to the Senate. Right now, it's in the Senate. It was first read in the Senate on August 13th, so it is moving. It's placed on the Senate's consent calendar, so it's kind of moving when they're in session. And there's also a companion bill, Senate Bill 4199, Prescription Drug Pricing Reduction Act of 2020, amending Social Security Act to lower prescription drug prices in Medicare and Medicaid programs, again, improving transparency. That was introduced on July 2nd, 2020, so it's recent. It's been read twice and sent to the Finance Committee. So in the Senate right now is Senate Bill 4199 and the companion bill H.R. 3 that are waiting to hear their be read in their first committee hearing. So if you want to contact our state senators and talk about those bills, those two directly impact Medicare pricing for prescription drugs.
Thank you, Mary. Carol is confused by the presentation. Can we now buy drugs from Canada, Mary?
No, we can't. It has to be approved by the federal government. And right now, the government is still working on its rulemaking, and that's supposed to happen by December. And then once that is finished, then Colorado will do its application. It's done a previous application, but has to wait for the federal government to approve the process.
Thank you, Mary. And that's a great question, Carol. Thank you for asking. Elaine would like to know, or isn't it, let's see, that we should be working to fix this problem with prescription drugs, I assume. Buy from the source and cut out the middleman. I believe we've seen an increase of pricing since the introduction of PBMs, another profit part in the cycle, I guess, and are now owned by private payers. So PBMs, this is a big issue. We definitely do hear about that at the Capitol. They initially were started theoretically to be a purchaser and bring down the price of drugs, but that is a big question if they are serving that function at present. So who would like to tackle the PBM question? AW, Mary? Which one of you wants to do that? She's pointing to, okay, go AW.
There were several pieces of legislation entered in Colorado to give more transparency for the PBMs. Unfortunately, because of the shortened session, many of those were not enacted. They were pulled. That is still a high priority for the consumers in Colorado, including AARP. We really would like to see more transparency in exactly what the costs are. We'd like to see if the consumers are really getting the rebates that PBMs say that getting because of how they negotiate with the pharmacy industry. So yes, there is some movement going, but unfortunately, due to the shortened session, many of these died.
And so Bob wants to know what's a PBM, and that's a great question, Bob. Most of you have a card, a drug card like this. That's probably from a PBM. That's a pharmacy benefit manager. It's kind of the middleman between your insurance company and the pharmacy. And again, they were initially started to bring down the price of drugs, but the question is, are they still doing that function? And that's something, again, transparency, other measures are things that we're very interested in. So great question. Appreciate that. We do use a lot of acronyms. So, don't be afraid to ask, like, WEP, what was WEP? That was a great question. And what is a PBM? So if we're not answering these things, don't be shy, ask us what we mean. John wants to know if we have a position on the public option for health insurance. That's a good question too. Who wants to take that?
I'm sorry, what was the public action?
Public option.
Oh, public option. We've gone, that's been a tough one for AARP, and we've gone back and forth. And it did die in the session last because of the shortened session. We finally decided that we would support it. There's a lot of pros and cons to that bill, but there's a lot, and there's been quite a bit of research on it. But at this point, it will probably come back this next session, and we do not take positions on it until we see the legislation, because I do believe that the legislation on a public option will change somewhat during the next session.
And that is correct. That group is meeting in the meantime, and several of our volunteers have engaged in that effort. We'll wait to see what next year's bill looks like. It's basically what's going to happen, I think. So, but good question. Something Bob mentioned earlier, and I want to go back to it. Everybody's going to get the option to vote on several things this year on the ballot. Bob, do you want to talk about our positions and talk about some of the ballot measures there?
Sure. As we all know, Colorado is an initiative and referendum state. We're going to see, I think, 9 or 10 items on the ballot this year. And they range from things like introduction of gray wolves to the kind of a restructuring of the Gallagher Amendment, which is a really important one. AARP Colorado is taking a neutral position on all the ballot measures except for one, and that one is Proposition number 118, and it's paid family and medical leave. And it's a detailed proposal, but it would provide up to 12 weeks of paid leave for medical situations and for family caregiving, which is why we are supporting that measure. As far as all the other ones go, we strongly encourage you to do your homework. The Blue Book will be coming soon. I think Kelly just sent an email earlier this morning from the League of Women Voters, right, Kelly?
And the official Blue Book is up online too.
And the official Blue Book is up online as of today, so that's breaking news. So as always, we encourage everybody to, again, do your homework and vote your conscience on all the ballot initiatives.
John wants to know, what should I consider with Proposition 116? What influence will this have on state revenues? Mary?
Let me unmute myself. 117. Okay. So
116.
116. Oh, the state income tax reduction?
Yes. So yeah, first if you tell us what it is and then there.
Sure. So this Proposition 116 is a state income tax reduction. It is a voter-sponsored initiative, which means they collected signatures to get it on the ballot. Passage would lower the state income tax rate from 4.63 to 4.55, about 0.08% on individual and corporate income tax starting in the year 2020, but payback wouldn't begin until January 2021. The projection is that it would reduce the state's general fund revenue by an estimated $203 million for the fiscal year of 2020 through 21, and by $154 million in the state year of 2021 through 22. The projected average tax cut would be $42 per year for individual income. That information came from the from the fiscal impact statement for this initiative back in April of 2020. So the Blue Book may have an update on that. I haven't checked that yet. And again, AARP Colorado has not taken a position on this initiative. So there'd be an decreased amount of taxes being brought in for state government.
That's a great question. Thank you for asking. Let's see, we have a new person joining us. Maybe she'd have a question for us too. Anyway, thanks everybody. Other questions? Let's see, here's somebody, she received, Helene received a letter today from the Center for Voter Information. Not sure if this is a real place, but it did come with an addressed envelope to Larimer City Clerk stating that someone at this address may not be recognized to vote. Then instructions to fill out info on the back and mail in that info to votecolorado.com. Or is this a real scam? I got that letter too and wondered the same thing. I don't know that I would send my information to anybody. You know, it's a good question.
So there are some resources. If you are registered to vote, you'll automatically receive your ballot. And you can check to see if you're registered. I did that. I think I did it through my county, but you can also, AARP has a link through that too. Another resource might be to updated election on recent campaigns.
Angela's looking up a link for you guys too. And Randy says go to larimer.org to check your registration.
Yeah, I would say go with your county clerk, you know, your county clerk's office and let them know you got that.
But it is easy to check your registration status. You just kind of put your name and your address and they tell you that you're active.
And that's the right way to go. Don't be skeptical. Very good. Always be skeptical about things that you get on email, you get in the mail, because there's a lot of hucksters out there and they're looking to take advantage of people. Which reminds me, that's one of the services AARP provides too. I don't know if everybody knows that. We do have a fraud watch program too.
Another suggestion is the ballots, as Bob mentioned, are going to be mailed on October the 9th and should be there at least by October 13th. If you don't receive it, you can still call your county and you can still get a ballot.
Angela put this in. The official website for the state is govotecolorado.com. That is the Secretary of State website. That's for sure not a scam. So check it there and throw out that letter. Throw that letter in the bin. That's where mine went. I don't know about larimer.org. It could be. It's
usually government offices are .gov. So I would not trust a .org or a .com. And I do have that same information. GoVoteColorado.gov for more information on what you need to know about registration, ballot initiatives, etc.
So that's the Secretary of State's office, and that card is correct, Helene, and you can respond to it. It's not a scam.
But I still wouldn't return that letter to somebody. I would just check it online. I would not return that letter just in case.
And if you find that you aren't actively registered, you can go to, you can register in person or online. You'll need a valid Colorado driver's license or state issue identification, and you can do that on govotecolorado.gov. Nifty AARP information.
Oh, we should check that because there are two different things here. It says govotecolorado.com, and then there's govotecolorado.gov.
.gov.
So that could be a scam.
At the very least, it's unnecessary, right? Because you can check your own voter registration with the county and you're going to get a ballot anyway. So I just looked them up. They're out of DC. So it's just, I wouldn't pay any attention to it either.
Yeah, I would ignore that.
So they both go to the secretaryofstates.com and .gov.
They're both the same, com and gov?
They both go to the same Secretary of State webpage.
Okay, that's good to know. This is a good conversation. We learn things too, so thanks, everybody. And it takes a village to understand all this stuff. Looking to see, are there any other questions? You're a good crowd. You've given us more questions than anybody else.
You guys are the best.
You always are, seriously. We always get very involved people out of Fort Collins. And we usually try to end our tour in Fort Collins because it's usually our best crowd. Let's see, the county website links to the clerk and recorder. I see that, Randy, thank you. Helena, I've been registered and voted in every election. That's good. You keep on doing it. Keep on keeping on. We do want to encourage you guys too, to make sure you do check out our webpage. We do have a lot of information on voting, and we will have our video voters guides for the 2 U.S. Senate candidates there. So we're pretty excited about that. You want my information, let's see, emails, let's see, that would allow us to reach out following the session. Here's my email address. Does anyone know larimer.org voter registration returns 618 results? Do you get any shortcuts to get to the spot to check my registration? Angela has this in the box. You may also go to aarp.org/CO votes. I think that's a great source for you. Just any of that. aarp.org.
That's /.
So, sorry, /. Anyway, it looks like people are sneaking out, which I understand. This has been our longest meeting too, because we had the most questions. So thanks everybody for joining us today. Again, kfritz@aarp.org if you have any other questions that didn't get answered. Thanks again. We appreciate you. Thanks, everybody.